Varicose veins affect an estimated 23% of adults in the United States, approximately 75 million people. Most are treated as a cosmetic issue. But the Edinburgh Vein Study and subsequent research have established that chronic venous insufficiency, the underlying condition, is a progressive disease with documented complications including venous thrombosis, venous ulceration, and skin changes that significantly impact quality of life. The good news is that both prevention and treatment have been transformed by the shift from painful surgical stripping to minimally invasive endovenous procedures, with clinical outcomes that are demonstrably superior. Glavitsky et al.'s 2011 Society for Vascular Surgery Clinical Practice Guidelines established the evidence-based classification and treatment hierarchy for varicose veins using the CEAP classification system, from C0, no visible disease, through C6, active venous ulcer. This framework changed the conversation from cosmetic management to disease management with staged, evidence-graded interventions. This video draws from 5 peer-reviewed studies across Annals of Epidemiology, Cochrane Database, Journal of Vascular Surgery, BMJ, and Phlebology, covering varicose vein epidemiology, risk factors, treatment comparison data, and evidence for compression therapy. The conventional view of varicose veins as a benign cosmetic problem has been displaced by venous disease research. B.B. Dimmer et al.'s epidemiological review showed that chronic venous insufficiency, the pathological progression of varicose vein disease, produces venous hypertension that drives skin fibrosis, hyperpigmentation, lipodermatosclerosis, and ultimately venous ulcers. The untreated progression rate from simple varicosities to ulceration is estimated at 1 to 2% per year. The Edinburgh Vein Study, a landmark epidemiological study of 1,566 adults aged 18 to 64, found that varicose vein prevalence was 40% in men and 32% in women, with a clear progression pattern from minor telangiectasias to symptomatic varicosities to chronic venous insufficiency. Risk factors were primarily genetic, family history in 50 to 75% of cases, but modifiable factors, obesity, prolonged standing, and pregnancy, substantially accelerate progression. Varicose vein symptoms are often underreported because patients assume they are normal features of aging. The CEAP classification system provides a structured framework for understanding disease stage and identifying where intervention becomes medically indicated rather than purely elective. Robertson et al.'s Cochrane Systematic Review comparing endovenous laser treatment, EVLT, versus traditional surgical stripping, ligation and avulsion, synthesized the highest quality comparative evidence available. The review concluded that EVLT was as effective as surgery for eliminating varicose veins, with significantly better recovery profiles, less pain, faster return to normal activity, and lower complication rates. Compression stockings are the most evidence-based conservative intervention for varicose vein management. Lim and Davis BMJ clinical review established that graduated compression, 20 to 30 mm of mercury for C2-C3 disease, 30 to 40 mm of mercury for C4-C6, reduces venous hypertension, alleviates symptoms, and slows progression, making them both a treatment and a prevention tool. Multiple treatment options exist for varicose veins, each with an evidence base quantified in controlled trials. The treatment hierarchy is now well defined in clinical practice guidelines. Varicose veins develop from valve incompetence in the superficial venous system, a progressive process driven by venous hypertension that leads from early valve dysfunction to full reflux and venous pooling. Understanding this mechanism clarifies both prevention and treatment targets. The evidence-based varicose vein management framework follows CEAP classification to match intervention intensity to disease severity, from conservative lifestyle measures in early disease to minimally invasive procedures in symptomatic or progressive disease. Recovery and outcomes from varicose vein treatment follow a predictable timeline based on the treatment modality selected. EVLT and RFA have transformed post-procedure recovery compared to the traditional surgical approach. Daily management of varicose vein disease combines conservative measures that address venous hypertension with appropriate surveillance for disease progression. Varicose vein management must be tailored based on disease stage, symptom severity, and whether the goal is cosmetic improvement or medical management of chronic venous insufficiency. Varicose veins represent a spectrum from minor cosmetic concern to progressive vascular disease with real complications. Here is what the science shows. The evidence is clear. The mechanisms are understood. And both prevention and treatment of varicose vein disease are within reach for anyone who understands what they are actually dealing with. Follow MedBrief Today for more science-backed health insights, explained clearly.